Hello everyone, welcome to my channel again. This is Dr. Das from Tiba Healthcare. और आज हम बात करेंगे basically the gadgets we deliver the insulin to your body. And there are many gadgets available in the town, in the market, like insulin syringes, there are flexi pens, and there are also insulin pumps. There are also insulin patches that's not available everywhere. But the mostly which is available is insulin pen and syringes. So we are going to talk about this. When a patient get diabetes and when the body is not able to produce insulin anymore and the tablet doesn't work, that time the only option we have is insulin. In fact, the insulin is one of the best and safest medication for the diabetic care. Few years ago in a diabetic conference, it was mentioned that if a patient diagnosed with a diabetes, it's better to start with insulin therapy because the side effects are much lesser compared to the tablets. So when we tell a patient that you might need to be on insulin, they usually get scared and they try to continue with the tablet or they increase the dose of the tablet. But it actually eventually causes more damage and complications because of the side effects of the medication. Now when we think about insulin syringe, we usually think like syringe like this, the syringe, big syringe like that. But this is not actually in reality. The syringe for insulin, they are very thin. Many people don't even feel it when you inject them. It looks like this, and the syringe is very small. This has been there for a long time and in market, and usually you use it and throw it every day. After that, there was a pen, flexi pen came in the market. Now these are like flexi pen. There's a meter here which you set how much insulin you're supposed to take. And if you open, this is the insulin inside the pen. Now this is use and throw. You use and throw it, so you cannot remove this. Also there is a pen available like this. You can open it. You can put the insulin. It's like a pen. You use it and you throw it. Now if you compare to this insulin syringe, you can understand this is much thinner. So this is like this much and this is like this much. But many people ask us in the clinic like, shall I use this one or this is better? Well, if you talk about compatibility, this is very easy to use because you just have to measure how much you have to take and you just have to push. But in this, many people don't feel comfortable because it's like a syringe, and the syringe is also longer than this. So this one, to inject this one, there are vials available like that. So you take the syringe and take the amount of insulin you need, then you inject to the body. Now both are available in the market, this needle and this pens. Now in this pens there are also available this use and throw technique, which you can just use and throw this, it doesn't open. And also there is a pen available which is you can open it and refill the insulin and you can reuse it. If you see, the needle is very thin. Now there are pro and cons using those two when you use this syringe and this pen. In syringe you have to take the vial, you have to use the vial and you have to take the insulin and inject. If you compare, this has more insulin than this if you buy, and this is economically, it is much cheaper because this is more comfortable and this is little bit, people doesn't feel comfortable with this, so this is more cheaper. You get more insulin but cheaper price. This one you get lesser insulin but it is very easy to use. Second thing is, because of the needle, it is so small, it doesn't matter how you injecting. Usually you're supposed to inject 45-degree angle because the insulin need to reach your subcutaneous layer, not muscle layer. So it doesn't matter how you're injecting, it will not reach the muscle layer. While this one, because it's bigger, if you do not know how to inject and it reaches in your muscle layer, it absorbs very quickly and it destroys. So even after giving the insulin, if you see the sugar is not controlling, that means you are not giving the insulin properly. There are other things also available, like there's insulin pump and insulin patch. Those are not readily available. Some countries they have insulin pump, and sometimes the refill is not available properly, the cartridges are not available properly. So the market right now, we have these two things available readily. And there are different type of insulin, like intermediate, short term and long term. That depend on which kind of insulin you use. I hope I cleared all things about insulin. If I missed anything, you can just write in my comments. And please share this video with someone who really need, and don't forget to subscribe, because we are trying to help other people who really need this kind of videos. I am Dr. Das from Tiba Healthcare, and you have a good day.